actually a very fascinating topic. For preparation of this topic, I have gone through the future of healthcare. It is amazing that recently I have read somewhere that Elon Musk told that humans can live for 150 years or 200 years in coming future, and he worried that long life of humans may be the problem. The new next generations may not have chance to learn. That will be the biggest problem in future with the advances in artificial intelligence. And going through this, it is actually fact. Humans can live forever. Forever means hundreds of years. With the advances in the miniatures, sensors, algorithms, processing and data analysis, and the automated treatment systems. Almost entire human intervention in healthcare will be replaced by the systems. Closed loop system means sensors will analyze the physical parameters, set parameters, whether it is ECG, heart rate, blood pressure, SpO2, whatever the designated parameters will be assessed by the miniature sensors, and the data will be analyzed by the advanced software. It uses a preset of algorithms to take some decision on treatment, and the treatment orders will be given to the machines. The treatment will be executed by the machines with precision without a human intervention. This is the closed loop system. Entire loop will be filled by the sensors and the system. Rarely human intervention will be needed. This is being happen. A lot of research is being happen. And one more advantage is that after giving some treatment or some infusion or some decision, immediately the response will be monitored, it will be noted, and the feedback will be again given to the system for future better treatment. Suppose if we need to have one decision on some new treatment, we need enormous lot of data that comes from the publications, and data has to be analyzed whether the treatment is sustainable or not. This is not going to happen. Real-time data will be processed, and the data will be communicated among the systems, and the next day itself better treatment will be provided by the system in a personalized manner. That is the future of the healthcare. Till now we are following the open loop systems, where the set parameters will be monitored by the machines, that will be monitored by the doctors or the clinicians. They will monitor the parameters, they will take the treatment decision, and if at all any machine is there also, that treatment decision will be decided by the humans, and human intervention is there, and decision will be executed by the machines. That is the current thing. Suppose a patient requires on ventilator, developing worsening of hypoxia, clinician will decide whether to increase the oxygen percentage, increase the respiratory rate, or increase certain parameters. Whereas in closed loop systems, the system senses the certain set of parameters, and it uses algorithms, that was preset algorithms, and immediately the decision will be made, and the command will be given to the ventilator to adjust certain parameters, and the response is also monitored. If the response is not desired, another response will be given. It is real time, and personalized care will be given in the closed loop systems. It is the future. In open loop system, at one point human intervention is needed, whereas in closed loop system almost human intervention will be there will be no human intervention, and the feedback and again next response also will be decided by the machine learning, artificial intelligence. This is the future of the healthcare. Here there will be sensors which senses the patient parameters, whether it is vitals or some lab parameters, and this sensed data will be analyzed for processing, and after processing they use certain set of algorithms decided by the artificial intelligence, and again the therapeutic decisions will be ordered to the machines, whether it is infusion pumps or the ventilators or fluid administration machines. And they will execute the decision, and the response again, whatever the response is there, again sends it back for the better response next time. This is the cycle. This is the closed loop. And the research started after the Second World War. First, the research started in detecting the abnormalities in the ECG and the better control of the blood glucose. This happened in 1960s or 70s. In 1990s, we all know that the Holter monitoring system is there, which monitors continuously the patient's ECG and the abnormal rhythms. After 2000s, smartphones and wireless communication has changed everything. Whatever the data is immediately sent to through wireless Wi-Fi or Bluetooth or certain mechanisms to the cloud computing or computers, where they take the decisions. These are the foundations for the wearable ecosystems. There are advances that came in the sensors, miniature sensors or nano sensors, and the advancements in the battery technology had led to the wearable devices, particularly in the sector of insulin infusions or insulin management for the diabetics or the cardiac desynchronization therapy. For these systems, wearable sensors, micro sensors and the nano sensors and the micro high capacity batteries, long lasting batteries have changed the system. That almost revolutionized the technology. We all know that we are wearing watches which monitor the ECG, SpO2, heart rate, and our sleeping patterns. Everything is being monitored by if we have certain apps monitored, these things can be monitored by the watches and the smartphones. Till now we are using the open loop. This data we are analyzing and is being presented to a clinician. He changes the treatment. Whereas in future, this entire data in real time will be monitored by the artificial intelligence itself, and the decisions will be made by the cloud algorithms, and decisions will be made by the engines, and they give prompts to the infusion machines. This is the future. So from 1950s till now, in 1950s, early ventilators and industrial control pumps were invented. Whereas by 1980s, microprocessors using infusion pumps, programmable drug delivery pumps came into limelight. By 2000s, wearable watches, wearable sensors, and the smartphones, artificial drug delivery systems which detects the blood glucose levels and delivers the insulin. It is like an artificial pancreas. These things came into practice. From 2010, artificial intelligence is taking over all the systems, and decisions will be made by the artificial intelligence, and this machine learning is one part. Whatever the response is again is being processed by the artificial intelligence. Next response will be a better response. This is the actually machine learning. The core components are the sensors, data processing algorithms, and the control mechanisms by advanced softwares and the hardware. Therapeutic delivery systems like micro pumps, micro infusion pumps, and another core component in the future of healthcare is the feedback loop for continuous optimization. Whatever the response given by the machine will be monitored by the machine itself, and it will deliver a better response next time. That is the utmost important. Sensing will be, all parameters can be sensed, whether it is heart rate, whether it is ECG, rhythm, SpO2, blood glucose, temperature, patient movement patterns, patient sleep patterns. Everything can be sensed in future by using miniature sensors. And processing is, we all know that there are AI itself is developing its own code in systems to process and to generate the algorithms for the better treatment. And the miniature drug pump machines or the miniature pacing machines or wearable pacing machines, neurostimulation devices, they will deliver the treatment. And is one more thing is Internet of Things. All certain set of machines will communicate among themselves. It is like we communicating, a doctor is communicating with a clinic nurse and a physiotherapist or other staff. These machines, a ventilator will communicate with the monitor will communicate with the infusion pump. This Internet of Things, this is called Internet of Things. This is the new word actually that is coming into practice. All things will communicate with themselves, among themselves, to decide the treatment options. Suppose an example, if ventilator is there, if there is a patient is suffering from hypoxia or hypercapnia, that will be sensed by the sensors. That if the system will analyze the ventilator patterns like FiO2 or breathing pattern or the pressures, that again it will communicate with the monitor whether the actual problem is there for the patient or not. Altogether it will decide an algorithm for treatment that communicates with the infusion pump. Suppose patient is hypovolemic, again fluid bolus will be automatically given. Our cardiac output is going down, cardiac index is coming down, inotrope strength will increase, or the FiO2 increase need is there, automatically it will increase. This is not a myth, this is going to happen in future. Everything is communicating among themselves. So now this is the concept of the closed loop systems. And another concept is wearable closed loop devices. Again the miniature sensors, miniature processors and the advances in battery technology is causing the wearable continuous glucose monitors, glucose monitoring using continuous glucose monitoring systems that are wearable. Now we are all wearing. We are wearing at the deltoid region. This glucose levels will be being transmitted to the phone to analyze the clinician to analyze the data. Whereas in future this monitoring system from the phone, it will be the signal will be sent to the infusion pump to deliver insulin in real time. That is the future. Whereas smart watches detect the arrhythmias, they alert immediately to the clinician, patient, and alert the CRT machine. So to deliver prompt treatment, that is going to happen in near future itself. Whereas the blood pressure, continuous wearable blood pressure monitoring systems, and actually that is there in since 1990s, nitroprusside infusion pumps, which were automated nitroprusside infusion pumps were there to deliver nitroprusside to actually optimize the blood pressure in post-surgical patients, particularly CT surgery. Whereas now for uncontrolled hypertensive patients, continuous blood pressure monitoring systems will be coming in place to decide the infusion of certain drugs and neurostimulation device for elderly people. These are all wearable. These things will come into practice in another 10-15 years. It may not take the 10-15 years also. And these closed loop systems are coming into practice in entire systems, whether it is in acute care, operating theater, anesthesia delivery systems, or the hemodynamic monitoring and automated drug delivery systems in the intensive care unit patients, or ICU blood glucose management, or antibiotic levels will be monitored by the systems, and they decide the proper antibiotic dose depending upon the digital clone or digital twin systems, how antibiotic will be metabolized to certain patient, for that patient, how much dose is needed, how much, and they will deliver the infusion to certain level and maintain blood levels, MIC levels to have better antibiotic response without much human intervention. These are the future of healthcare. This is actually the 1990s image where Medtronic in collaboration with GE had started a program of automated anesthesia delivery system. It monitors the patient EEG, patient heart rate, blood pressure, end-tidal carbon dioxide, SpO2 levels, automatically adjusts the FiO2 oxygen, automatically adjusts the propofol infusion rates, or the anesthetic gas delivery. Everything will be automatically adjusted. This will be the future. Almost this is accurate anesthesia delivery with minimum complications will be there in future. Suppose we have a patient in ICU who developed metabolic acidosis or respiratory acidosis. we'll have certain algorithms. What will be the primary cause? What will be the optimum treatment next to be given? These algorithms, entire algorithms will be taken over by the software and the hardware systems to deliver the proper care. Whereas in chronic disease, artificial pancreas, we all know that there is enormous research is happening for artificial pancreas, whereas the automated infusion pumps, continuous blood glucose is monitored, and real-time infusion of insulin will be delivered to the patient, and the response also. Suppose for patient who is having 500 milligrams of blood glucose in ICU, we will give an order of certain amount of insulin to be given to the patient. We cannot immediately measure the response. Suppose in patient in stress, sepsis, his insulin requirement may be high, whereas patient is in liver failure, insulin requirement may be low. Whereas the automated insulin pumps will immediately monitor the response, and they will decide the next dose. They will adjust the dose depending upon the patient's disease pattern and the requirements and the genomic system also. That is the future. And cardiac rhythm management devices. We can say that already that is there in the system. Till now we are using the system which is programmed by the doctors or the technicians. In future, suppose I am sleeping, my heart rate requirement or my oxygen requirement will go down. Then the system will control the heart rate. Suppose my heart rate is increasing, I am doing some exercise. It may require an augmented response. Everything will be controlled by the cardiac rhythm management devices for certain set of patients, not for healthy people. And the remote monitoring platforms. This is another important thing. Wherever the clinician is sitting, he will be getting the real-time data. Wherever the technical people are sitting, he will be getting the real-time data, what is happening to the patient, and the data will be transferred to his phone automatically using the Internet of Things. If there is internet, it will be delivered to the needed people. This is the closed loop artificial pancreas system, where the computers, continuous glucose monitoring system, sensors will be there, and an infusion pump, a computer which is fully automated and controlled algorithms. It uses controlled algorithms to decide the insulin infusion, and it monitors the patient effect, and the data is being transferred to the clinician and patient himself. How that response is there, we can monitor real time. This is going to control the blood glucose. It will change the entire diabetic management system in future. Whereas in geriatric people, major problem will be the cognitive defects, gait abnormalities, accidental falls. Smart shoes will be there. Smart shoes will detect the patient gait pattern, pressure. Smart belts will observe the gait pattern. These things, whether he is climbing, going down, and his gait pattern, his reeling, everything will be monitored. They will respond immediately to the caregivers, patient relatives, and patients. This is the future, actually. Whereas for Parkinsonism, till now, DBS is there. DBS stimulates the brain to release dopamine. Most of the times, DBS success rate is very low. Using a smart algorithms, that is called proportional integral derivative mechanisms, which calculates the patient's P of the patient's pharmacokinetics and dynamics, and these sensors will sense the rigidity, movement, gait, everything will be monitored, and the desired amount of dopamine will be calculated by the algorithms, and the desired amount of dopamine will be infused to the system using miniature portable dopamine infusion systems to the patient, depending upon the scene. Suppose in stress, his dopamine requirement may be high. Suppose in normal time, his dopamine requirement may be low. Depending upon the need, dopamine will be infused in real time. These are the future. Wearable sensors, hearing aids, wearable belts, smart watches, smart shoes will detect the gait abnormalities. They will alert the clinicians or the patient relatives if at all any fall is there for elderly people. These are again, in future, a wearable sensor that is kept at a hat will use solar energy for battery recharge. That is the future. tears, our tears, sweat, tissues, there will be nano sensors. They measure blood glucose, they measure so many hormones, dopamine levels for optimum treatment. Advantages are we will get personalized therapy, genomic and biomarker guided real-time treatment loops, and dosing will be personalized. And one more advantage, biggest advantage is predictive analytics. The systems will analyze the future. They will, with Internet of Things, they will communicate with lakhs of similar systems, and they will decide certain ECG changes is there, he is going to get MI in next day, 24 hours, or next few hours. This prediction will be there. Suppose his temperature is rising, his urine output is going down, he may develop future hyperglycemia in next few hours. This predictive analytics, we cannot, with simply using human brain, we cannot analyze this. With lakhs of systems communicated, lakhs or crores of systems communicated together at single time, they will analyze the data and they can predict the future events also. When he is going to get an ischemic cardiac event, when he is going to get a hyperglycemic event, when the patient is going to get elderly person is having chance of fall, everything can be predicted in an accurate manner, and it prevents the mishap to happen. The benefits are definitely improved patient safety and reduced clinician workload. And this is one more thing. Here the availability of the trained manpower is big issue for the clinicians, for doctors. This will be with automation, this will be overcome. And continuous monitoring and early detection and prevention of the problems is another. Personalized treatment is the biggest advantage. Whatever certain drug may not produce same effect for everyone. Whereas with predictive models, algorithms, it can predict how much dose is needed, how much, when it is needed. This is the personalized treatment for everyone. Everyone's genome is different. Everyone's pharmacological response will be different. This personalized treatment can be given with the closed loop systems. Overall, it gives better outcomes and efficiency. But the challenges are there. Biggest challenge is cyber security. If there is one corrupt system or one corrupt virus code enters into the system, it can alter the hundreds of systems or lakhs of systems. That is the biggest, and within minutes it can cause chaos. It is like an atom bomb. This cyber security for the artificial systems where they are all connected all together with Internet of Things is the biggest problem, and the initial implementation of cost will be higher, particularly for the developing countries. And the reliability of the algorithms. What algorithms, entire data is from the system, data from the Internet only. If there is wrong data that is there in the Internet, these algorithms also can go wrong. That is the, you suppose X enters a wrong entry in the data. If I publish a wrong or unethical data in the public in a reliable journal, this data will be considered as correct by the system, and it will develop an algorithm based on it. It can cause a chaos. That is the big problem. And regulatory approval, because it is dealing with someone's life. Regulatory approvals will be very complex. That is another problem. And ethical concerns of using an automated systems without humanity touch in treatment is big problem. In near future, within few years, we can see AI-driven clinical support decision systems in our hospitals, and fully integrated automated systems in certain site of treatment like ventilator management, hemodynamics optimization in ICU, anesthesia management. These things we can see in near future itself. And already we are seeing the wearable ecosystems. Till now they are open loop systems. We can have few closed loop systems in blood glucose management or the Parkinsonism treatment management, and the remote autonomous treatment platforms. They are there now itself. We have the remote surgical robots, where the robot will be operated by the surgeon who is staying at a remote place, where the algorithm itself can operate the robots in future. It is in another 2 decades, we can have digital twins for the patient. That is the near, in another 2 decades we can see. Whereas for any treatment, the system will create what we call a digital twin simulation, how the treatment will work for that system, and it can, whether it is an optimum treatment or non-optimum, optimum treatment can be given to the real patient. And the advances in nanotechnology will change the sensors itself. And one more point is the continuous lifelong health optimization. From birth, everything will be sensed, will be recorded. The moment you go to the clinician, entire data will be displayed there. Suppose an allergy is there, X allergy, suppose I developed an allergy to some peanut or some tablet. Immediately this will be noted there. Without me escalating that to a clinician, it will be displayed on the table. This is going to, like Aadhaar card, the moment we go there, we place a finger, all our data, suppose with PAN card, it is integrated to PAN card, all our financial details is being displayed. Like that, with these sensors delivering, communicating with the computers, and the data is stored in cloud computing systems, and with Internet of Things, whenever the data is needed, with a single click, the clinician can access entire data. That is the future. In conclusion, our healthcare system is going to change in future. Human intervention is going to go down. We are going to see the artificial intelligence and machine learning systems will be taken care for most of the treatments, and they will give personalized care and better care, real-time treatment, automated dose adjustments, automated treatments, and it will give the better health care for all the humanity. This is the future. It is not going to take more than 2-3 decades, I think. Whatever the technology that, whatever the entire human mankind in lakhs of years, whatever it has seen in the till 1800s, from 1800 to 1950, in 150 years, enormous changes came. From 1950s to 2000, entire lakhs of years evolution, technological evolution came in 50 years. In another 5 years, it is going to change. It is going to change. Whatever the change that we expect that will happen hundreds of years will occur in 1 year. Yesterday I have seen a video. Last 2 years back, Chinese company robots failed to even walk in a football ground. 2 days back they have shown they are doing complex acrobatics which a human can never do. They have displayed hundreds of robots doing a systemic performance. That is going to change. Thank you.
Thank you, sir. Moving on to the next session.
Sorry, I think it is written in quantum dimension that my presentation will be the last one. And at least people who are sleeping, please wake up. Let's have an exciting session on the quantum cardiovascular medicine. I'll try to finish it up in 10 minutes, and all the students, I hope you're ready for the quiz as well. So the topic is quantum cardiovascular medicine, and this session would stay as a primer. The smallest particles are going to solve the biggest cardiovascular problems. So I'll just try to go through the general understanding of the topic and then speak about role of quantum computing in different domains of medicine. And then we'll speak about few limitations of quantum computing. So the goal of the presentation is not to speak about science fiction, but to prime you that this is going to be the future clinic. We all know that there has been recent start of construction of Quantum Valley in Amravati by the collaboration of IBM and TCS, and there they are going to put a 133 qubit IBM Heron processor. What this means, probably you'll understand by the end of the presentation. So we all have gone through leaps and bounds. Initial days were those where abacus was used for computing, then the Turing machine came, and then the Enigma. These were the ones where ciphers and symbols were used. But later on in 1954, Pradic machine, which was the first classical computer which used bits, came. Bits are nothing but zeros and ones. These use logic gates where and, or, and not are used, and they use certain sort of logic known as Boolean's logic, by which you are able to come to a reasonable conclusion from the whatever problem which was given to you. From there, we all know now I'm catching a laptop which is in size of just my hand. So the initial machine, as you can see, was of the size of a room. The same thing is going to happen for quantum computers as well. But there is a problem with the classical computers, and that's why we have the need of quantum computing. See, there is something called precision medicine paradox. We all know that we have multi-omic data now. We have data from all the variables and everything, where the data is going astronomically huge. But the classical computer have their own ceiling capacity. This results in an insight gap. This gap needs to be filled up to know better or to improve ourselves in the field of medicine or in other fields as well. There comes the role of quantum computing. This precision medicine and quantum computing are running parallelly till now, and probably this is the time of convergence, and in the future both are going to club together, and we are going to see a huge revolution in the field of cardiovascular medicine as well as other fields of medicine. So first things first, when I was given this topic, I just wanted to know what the difference between artificial intelligence and quantum computing is. Artificial intelligence just makes your computer think better, think like human. It uses pattern recognition and helps us in making decisions. It's just like your iPhone facial recognition, where your iPhone recognizes your face and unlocks the phone. Similarly, chatbot, a ChatGPT chatbot helps us in knowing an answer to a question. But quantum computer is totally altogether a different thing. It's probably, in our terms, it might be a super powerful computer. It solves very, very complex problems which normal classical computers cannot. As of now, it's still experimental, but in the future, it is going to be something which everyone will use it. So the thing is, AI makes the computer smarter, but quantum computing is going to make your computers faster. AI determines what decision you need to make, whereas quantum computer determines how fast you can execute it. So just 2 slides about the physics which you need to know when you're speaking of quantum computing. As I've said, classical computer depends on bits, which is zeros and ones, whereas quantum computer uses qubits, which is quantum bits. To understand this, you need to know certain limits of your classical computer. As I told you, classical computer is a bit, which is zeros or ones. It's like a light switch. It's either on or off. It cannot be both together. So if you want to model a drug which binds to a receptor, it will check each one of the orientation one after the other. This is going to be a linear thing, and it's going to take a lot of time and energy and space. But the quantum nature is different, that it will do it all together. So that there comes the quantum advantage. As I told you, qubits are the ones which we use. So unlike a switch which is on and off, it's like a spinning coin. So while the coin is spinning, it can be both head and tail before it drops and comes to a stable position. So since this qubit stays in superposition, it can check all possible orientations at once simultaneously. If you think about clinically, instead of checking one drug orientation at a time, it checks all drug orientations simultaneously. Similarly, there's one more property called entanglement, where one qubit, if one qubit is there in India and the other qubit is in, say, US, both the qubits are entangled. So something changes in this qubit, the other qubit also changes its orientation. Like if you think it clinically, if there is a gene A which mutates, so if it is causing downstream changes in C, D, E, and F. So by checking orientation of A by quantum computing, you'll be able to identify what is happening to the downstream genes as well. So classical computers read one book at a time in a library, whereas quantum computer reads all books together parallelly. That's what makes it exponential. So just going into the clinical aspects of it, so the most important part is diagnostics. In diagnostics, in the field of oncology, there has been much role in mammogram, lung cancer detection, as well as prostate cancer detection. It was found to be much more sensitive and specific than the classical computers and artificial intelligence. When it comes to cardiovascular medicine, one thing which is already being used in research is the magnetic fields or the magnetocardiogram. We all know about ECGs. ECG has been there for hundreds of years, and it picks up the electrical signals of your heart. But quantum computer will be able to pick up your magnetic field of the heart. One might be wondering whether heart also has a magnetic field. Yes. anywhere where the current flows, there will be created a magnetic field by Murphy's law. So this magnetic field can be detected early, and the detection level is so sensitive that it can pick up 10 to the power of minus 15 Tesla, which is femtotesla. So this is something which is coming up in a huge way. There has been a study on this also known as magma study. So you have quantum sensors which are known as squids. Squids are the ones, just think it, you don't need to know the physics of it, because just like an iPhone, we don't know what is inside the iPhone, but you use the applications of it. Similarly, there are certain quantum sensors known as squids, which are superconducting quantum interference devices, which picks up the magnetic field at such a sensitive level that when a patient who is having suspected inflammatory cardiomyopathy, MCG was able to pick up this inflammatory cardiomyopathy much more sensitive way and the specific way with more than 90% positive and negative predictive value. And when it was compared with the endomyocardial biopsy as well, there has been a tremendous gain of utility of the same. And just imagine, you walk into a room and you get a 60-second scan, and you are able to say whether this patient will get MI, whether this patient has inflammatory cardiomyopathy, without even having anything else, is going to be a revolutionary thing and a game changer in the future. The same thing as discussed previously. I'll go quickly. So this is the squid which I was saying, but the problem with squid is it requires huge infrastructure, and requires the squid or the quantum sensors to be maintained at a very low temperatures. But in future we are going to get wearable sensors of quantum, where your watch, say this quantum sensor is embedded in your Apple Watch. You might be able to detect your pulse rate variability, arrhythmia detection, and heart rate variability in a much more sensitive way, and predict the risk of sudden cardiac death of the future as well. Probably that might be there in the future. So with respect to drug discovery also, as I've mentioned previously, the drug orientation can be determined easily by a quantum computer. This helps us in determining the way the molecule needs to be manufactured so that it can bind to a specific receptor in a much more easier way. As of now, we require tens of years or decades of time for a single molecule to be developed. But by probably the next decade, when we have quantum computers, you'll get an instantaneous pill based on your genomic data. This might be a revolutionary thing in the future as well. And the third thing is the digital twin, which our previous speaker was also speaking of. So digital twin is nothing but a dynamic replica of yourself. So your whole data, the omic data, MRI, ECG, echo, everything is fed into the algorithm. And then a replica of yours is made, and everything is tested on it first. So say you have some fever, and you have a molecule which is designed by quantum computer and given to the digital twin, and see how you're responding, in how many days you're responding, and whether you have some side effects or not. And then if it works well to the digital twin, then the pill is given to you. So probably this is one thing which is again a future thing. And we also have evidence now that though not using quantum computers but with classical computers, artificial intelligent digital twins are made, where a what-if scenario is made. Say you have AF ablation which needs to be done. So 1,000 or 10,000 what-if scenarios are made and checked whether at a specific ablation, at a specific site, at a specific energy, does prevent the trigger, and the electrophysiologist can just go there and ablate it without any side effects or complications. In the morning also, Ramesh sir also speaking of it, the CT-FFR technology which we have now is a digital twin. You have your CT scan done to the patient, your model is made, which is a digital replica of yours, and then the hemodynamic parameters are embedded into it, which becomes your CT-FFR, and then a virtual stenting on it can be done. This is being done by classical computers now, but in the future, quantum computer will do it with millimeter accuracy. The same thing can be done for your TAVI valves. You can just place them in the exact position and with millimeter accuracy and see whether there is any paravalvular leak or there is any rupture of the outflow tract and all before even doing it to the patient. The same thing for genetics and epigenetics. You know, genetic and epigenetic thing is one thing which classical computers never cracked, because there has been something called curse of dimensionality, because it's a huge data which classical computers cannot handle. The same quantum algorithms, few algorithms were developed like Shor's algorithm and all, which can sift through trillions of base pairs, trillions of permutations, combinations, and then decide what sort of genetic and epigenetic modification will help us in keeping the patient alive for 120 years, just like in the morning Dr. Anusha was discussing. So regenerative medicine, all these things are going to become much more easier once quantum computers come. Same with tissue engineering as well. You need to know how, at a quantum level, your scaffold interacts with the cells, how the cell members work with each other, how the ions move in a quantum way. Once you know all this information and once you're able to develop an algorithm where the mechanical stresses between the cells is known, so there will never be a problem in developing the model. Most often what happens in tissue engineering is you try to replicate an organ or something, but the initial cells don't attach with each other or die off because they don't have proper level of signaling. These sort of predictive modeling will also become much easier, and printing of heart might just be a cakewalk in the future. So having said this, all these things, then why is it not wide scale adopted yet? As I said previously, this requires huge amount of infrastructure, huge investment, and you require to keep these quantum computers at a sub temperatures of, say, in the level of 4 Kelvin, which is minus 269 degrees centigrade. So having such an infrastructure is one thing which is very difficult of, and second thing which is said is decoherence. So this quantum bits, which is qubit, need to stay in a coherent state. If there is some noise to it, it will decohere. So to maintain the coherence is still a huge challenge as of now, and scalability. As I've told you in the beginning, our Amravati Quantum Valley is coming up with 133 qubits. Just imagine, this laptop which I'm holding now has trillions of bits. So when we are speaking of 133 qubit versus trillions of bits, we have huge way in quantum computing to go. Once we reach that mark of thousands or lakhs of qubits, then it is going to overtake everything, and they are going to be our future. So scalability still remains a challenge. Data integration with all the data which we have, which is derived from the classical computers, and integrating with quantum computing is one thing which we still need to sort out. And the final thing is something known as black box. Say if you have a aeroplane, and if it crashes, you might have heard that we collect black box from it. Black box is one thing where no information goes out of it or comes inside it. So even in the era of artificial intelligence also, people speak of this black box. So you ask ChatGPT one question, it gives you your answer. But sometimes we don't even really know whether it is hallucinating or it is really telling based on an inference which is biologically plausible. I get fever, it is because of malaria. I have a biological plausibility to it. But when you use artificial intelligence and quantum computing, they might give you such answers which you didn't even think of, which at least to our human brains is not biologically plausible. This is something called the black box phenomenon, because if you want a regulatory approval to something, it should be biologically plausible. So black box will still remain a hurdle for the quantum computing and the systems derived from it to get a regulatory approval. Once these things are navigated through, we are in the way of quantum era, and I think everyone will be using quantum computers, and everyone will be using specific applications derived from the quantum computers. We need not know all this physics. We just need to know how to use WhatsApp. Similarly, we just need to know the biospecific application derived from quantum computing. Certain things have already been developed, like Qiskit from IBM or Pennylian for quantum machine learning. These applications will come in the future, and it will be just a cakewalk for us to deal a patient. For a patient or ourselves to live for 150 years. Everything might happen, might not happen, but the way forward, looking at it, looks like it will happen for sure. If not in 10 years, probably in 20 to 30 years. One thing I just want to conclude saying, pondering upon is, I was speaking of quantum computers, but there is a speculation and theory that probably our human heart itself is a quantum device, and we might reach into such a level where we will know that heart itself works like a quantum device, and you need quantum computers to tackle a quantum device. It cannot be the other way. You cannot do it with classical computers. So that might be the way forward. Concluding, you just need to know a bit of physics, superposition and entanglement. In diagnostics, magnetocardiography is coming up in a big way. Digital twins in quantum classical computing is there now. With quantum computers, it is going to go in a big way. Drug discovery is one arena which people are hopeful for with quantum computing, and it might just cut down the period for drug delivery. Quantum machine learning and genetics are the future areas where quantum computer would shine again. Thank you.
Thank you to all the panelists, and thank you, sir. Now we are going to conduct the quiz. We hand it over to Ramanohar, sir.